Have you ever noticed your dog slowing down a little, maybe hesitating before a jump, stretching differently, or just moving in a way that feels slightly off, and wondering if this is just age? You are not alone, and that is exactly what we are diving into on today's episode of Tails and Tones. Hi there, and welcome to Tails and Tones. I'm your host, Mariska Nell, also known as Piper's Mom. Now, this podcast exists to help modern pet parents simplify everyday care and elevate life with their dogs without having to sacrifice style, sustainability, or peace of mind. It's a space of it's a space for thoughtful conversations, expert insights, and real life stories that make dog parenting feel a little easier and a lot more connected. I'm so excited that we are welcoming today's guest, Dr. Laurie McCauley. Dr. Laurie is truly a trailblazer in veterinary rehabilitation with a deep passion for helping dogs move better, feel better, and live fuller lives. After graduating from Colorado State University School of Veterinary Medicine, she went on to open the very first veterinary rehabilitation clinic in the US and even designed the first underwater treadmill for dogs because she saw what was possible for canine movement before the profession really had a name for it. She is board certified in canine sport medicine and rehabilitation, the founder of Optimum Pet Vitality, and has spent decades educating both professionals and pet parents around the world on how movement, awareness, and thoughtful support can completely change a dog's quality of life. We're so grateful to have her here today. Before we dig in, one quick note. We've recently announced our very first Tails and Tones product, an elevated food and water system designed to support healthier, more comfortable meal times. We're building it slowly and intentionally alongside our community as well as trusted experts. And if you'd like to be part of shaping it, you can actually join our founding pack via the link in our Instagram bio at Tails and Tones or in the show notes. Alrighty, let's dig in. Please give a pawsome welcome for today's guest, Dr. Laurie McCauley. Welcome to the podcast, Dr. Laurie McCauley.
Thank you. Thank you. I'm so excited to be here.
Oh, we're so excited to have you here. And for our listeners who might be new to your work, could you maybe introduce yourself and tell us a little bit about what it is that you do?
Sure. I'm a little bit of a dinosaur. I graduated vet school in 92. I did 6 years of general medicine and got bored. I was like, oh, it's another vomiting cat or dog with diarrhea. And I fell down the stairs at 3 in the morning, putting my dogs out and hurt my back. And my chiropractor couldn't fix me. So he sent me to an ortho guy who sent me to a physical therapist. And I went, oh, this is so cool. We can find problems and fix them and then make them stronger so it doesn't happen again. And I thought, oh, I'll just take a class in this. And there was nothing. So I opened up the first rehab clinic, designed the first underwater treadmill. I did some research with, if you ever saw from long ago the TV show Emergency Vets, I went there and did some research at Alameda East, which was super cool. Came back, the first underwater treadmill was literally a human treadmill that they would put in a pool, and I put it on a jet ski lift. I had to have it soldered on with a crank
Wow.
to crank the animals down, and then I had jets coming in from the side, and I called the zoo and figured out how to get aquarium glass so we could have glass, and then we had a home camera, like a for outside for security, that was then sent to a computer monitor hanging from the ceiling so we could be in the pool with the dogs and watch how they were walking. And that's how the underwater treadmill started. And then I presented that at the first International Symposium on Sports Medicine and Physical Therapy. And me and several other people got together and we started the first rehab certification course.
Oh,
So
wow.
we were teaching, I taught vets, techs, PTAs how to do rehabilitation for dogs. And it's just the love of my life. My goal in life is to teach and empower people how to help pets have their longest and happiest health span. So staying healthy and lifespans.
I mean, that is something that is so important with dogs. And I mean, like, even with us, we didn't really know certain things until you know that. And then it's like, why didn't I know about this earlier? And like, I mean, when Piper did her first session in, the water treadmill, I was like, wow, this is so cool. Like, we need to get one at home. And then I like look at all these tanks and stuff and like, yeah, we maybe need a new room to put the treadmill in. But yeah,
Yep.
it's definitely something that that is so beneficial that you can see. There's so many different things for us even with Piper. We didn't know about the certain stuff. So when dog parents kind of notice that like stiffness or like slowing down, many assume, oh, it's okay. My dog's just getting older, he's no longer that little puppy that jumps up and down. But from your experience, like what is often really going on?
So there's so many things, right? So age is not a disease. And as we age, muscles literally um, at first get infiltrated with fat and then with scar tissue. So even like Arnold Schwarzenegger, people who are really big, as they age, they lose muscle and stiffness. And you're not going to see people who are very active sit down and do nothing, right? So there's 80, 90-year-old people who are going and playing pickleball and having fun and even like doing silver sneakers, which is an exercise program for older people, uh, and they love life. They live better, they're healthier, they have less disease, and it's the same in the dogs. Keeping them active and healthy is so important. So when you see the dog slow down, that's a sign. So if they hesitate to go up the stairs, if they hesitate or I don't know if I want to jump on the couch, jump on the bed, jump in the car, all of those things, or even just not like when you come home from work or the grocery store, if they're like not right there to greet you, that's an early sign that something's going on. And it's always better to find and fix problems when there's small problems, rather than waiting until they're
Yeah, and I mean that is something that that is so crucial to kind of, look at those early signs and things. And I think that's great that you kind of mentioned that. And after Piper has had her laser therapy and been walking on this treadmill, but she did have another surgery prior to like remove teeth. So we were like, is it the teeth? Is it the treadmill? Is it the laser? Like, what is it? Whatever it is. And also put her on a joint supplement. And she is like doing 2 rounds of zoomies in the evening. She is like running. Like, I was like, wow, this is amazing. And yeah, so there's a lot of stuff that kind of contributed to it. So I can't really pinpoint one thing, but definitely like it's changed her life, I would say.
Oh, absolutely. And that goes back to finding things when they're little things, not just waiting until they're big things, right? Keeping them in that double zoomies
Yeah.
and fun life, right? Um, humans, there's lots of supplements for humans. There's good and bad ones. So you want to know which are the good ones, but there's great ones that will help keep their muscles strong and their joints healthy, decrease inflammation. They tie aging to inflammation. So by controlling inflammation, you slow down aging so that they live longer, right? And weight control is super important. Uh,
Mm.
there's so many things. And just exercise and not just running your dog, but also doing controlled exercise for strengthening. In humans, they say in order to live the longest, to put off mortality, there's 3 different kinds of exercises you need. You need endurance exercise, so that's like going for a walk or a run or a swim. There's strength training, so in humans, that's doing weights, and dogs, there's specific exercises we can do, and then proprioception or balance. And by
Oh.
doing those, that has the largest effect on all-cause mortality or what kills people. And it's the same with the dogs. I've had my golden retriever, Rudy, was 15 and a half, and at 12, he had osteosarcoma, and we did a partial amputation of his leg, and he had a prosthetic, and we still went running. And he played in
Wow.
this, right? And I lost him at 15 and a half. My dachshund, I lost at 18 and a half, right? So there's so much we can do to help these guys.
Yeah, wow, that's fantastic. And obviously, as we are kind of in this space where we definitely want our, fur babies to live as long as they possibly can, but not just that, so that they are healthy, they are happy, they are mobile. And they can just like go and enjoy life as well. There was something that was also like kind of, you know, almost that you need to look into. And it was kind of the first time I heard about that. And that's the fascia, am I
Pasha,
saying fascia?
Pasha, yes, yeah.
Yes. So if someone hears that name for the first time, like how do you explain that? And yeah, why is it important?
Fascia is super, super cool. So fascia is everything around every cell. In fact, there's electron microscopy. Sorry, I'm going to get nerdy for a second. Just
No
I get
worries.
so excited about it. That shows that not only is it around every cell, but it goes in and touches the nucleus of every cell. And it's all connected. It's one sheet. So the fascia that's on your little toe is also on the top of your head, is also on your fingertips. It's one sheet, and it has thickened areas. So people who are like hunched over, you can sometimes, if that's the cause, literally fix their fascia and they can stand up straight.
Wow.
People who, they can only bring their arms so far back, and then you work on their fascia and then they can go back to normal. Um, it is so very, very cool. And the way to think of it is, if you've ever cooked a Thanksgiving turkey, or I don't know if in Dubai you have turkeys for Thanksgiving, but if you've ever cooked a turkey and you took your butter and your herbs and you put it between the breast and the skin, you've just pushed your hand through soft fascia. So that's
Oh.
really loose and dense fluid flows through it. That's how our immune system works. And then if you've ever had a steak where you cut and there's like grizzle,
Mm.
that's dense fascia. So dense
Oh.
fascia controls the tissue, it helps support it. Fascia is literally responsible for up to 40% of the power that contracts every muscle. So
Wow.
when it's damaged, or it is what we call sticky icky, and it can't do that. So you have less ability to move, you're going to have more stiffness, you're going to have more disease. There's a study in rodents that show that a whole bunch of rodents were injected with cancer cells, and then half of them did stretching to stretch their fascia, and they had significantly less metastasis.
Oh,
And the
wow.
reason is the fascia is what all the fluid goes through. So the cells get rid of the metabolic waste and the toxins. All of that has to go through the fascia to get to the lymph system. So your lymph nodes, your lymph ducts, and then that gets dumped into your blood vessels, your subclavian vein up here, that then goes to your liver and you get detoxified, right? And then that's your liver takes care of all that. But if the fascia is what we call sticky icky, so you can have fat and toxic metabolic waste and toxins, and it gets all icky, the fluid can't flow. And if
Oh,
the
wow.
fluid can't flow, your body can't get rid of all that stuff. And then you have more dis-ease. So you can literally enhance your immune system by getting all that flowing.
Oh, wow. So would that just be kind of, we can get it flowing by doing some exercises? Do we need to do other things?
To run, right? Or any exercise where you're like,
Mm.
every time you, that creates a vacuum between your lungs and your chest and helps pull the lymph down through the terminal duct and the thoracic duct into your subclavian vein to go to your liver. Every time you do yoga or you're stretching your fascia, which causes the fibroblasts, the cells that help strengthen structures, to increase ATP, which is the energy for
Oh.
the cells, to increase. and it helps push all that fluid through the lymphatic system.
So I am definitely going to take my running coach, like daily shakedowns, a little bit more serious from now on.
Yeah, yeah, and for dogs, it's their running in the yard or their
Wow.
what we call doggy yoga or cookie stretches, right?
Mm.
Taking the nose to the shoulder and their butt, down behind their feet, chest, floor, between their front feet, and then up to extend everything. That's literally stretching all the fascia lines.
Like with those cookie exercises, how many times do we need to do that at a time? Is it like, do 3 sets, or do we do 10? Like, what, or do we do a few throughout the day?
Yes, yes, yes. So there's no studies that show exactly more is better, but not like, oh, we're going to do it for an hour.
Yeah.
There are studies in tendons and fascia that show that if you do it twice, and this is again studies in rodents and humans, not dogs, but if you exercise and then like 6 to 8 hours later, you do stretching, you significantly increase your ability to lay down collagen, which is strengthening the fascia to prevent injuries and help with the immune system as well.
Oh, that's
So
so interesting.
even if you
Yeah.
spent like I work Sid, my dog, twice a day for 20 minutes, right? Now,
Wow.
not expecting everybody to do that. But even if
Yeah.
you do cookie stretches before you feed them and maybe stretching them before your walk or when you get back or anything is better than nothing.
Oh, I love that. And oh my goodness, I am going to link that video in the show notes, and I'm also going to post it on our socials because, like, Sid is like, I can't even do those exercises. Like, honestly, balancing on a ball, not just
Yes.
balancing on a ball, but literally walking on the ball forward. And it's like these big Pilates balls. So,
Mhm.
like, our listeners just have this vision and literally going forward and backwards. And I was like, no way. No
Yeah.
way. That is phenomenal. Obviously, there's a lot of training to get to that
Oh,
point, but
yes.
like that core strength must be
So
phenomenal.
when Sid came to me, he was 11 months old, and I had gone to the Humane Society because I always get rescues. And he, I literally went in to get a 12-year-old dog. I'm like, no one's going to adopt this one. I'll take this one. And I came back, and that one was adopted. And Sid started screaming, and I'm like, oh my God, that's my kind of dog. And they're like, yeah, no, nobody wants him because he screams. So, and he ended up coming home with me, and I'm
Yeah.
like, okay, I'm a rehab vet. You have straight knees, straight shoulders, and a long back. You are not going to have a cruciate injury, a shoulder injury, a psoas injury, or a back injury. And I started an exercise program with him. And that's where Core and More, our exercise program started. I sent it to a bunch of friends, and Laura, one of my friends in Chicago, had a 9-year-old agility dog who was competitive. And she did, and she's like, "Oh my God, Laura, you have to teach other people this." Sophia started at 9. At 11, she was the 7th fastest dog in bad dog agility for Shelties her size.
Wow.
Um, yeah, yeah, yeah. And Laura said, "I never knew the potential my dog had if I did the right exercises." So
Yeah.
exercising is super, super important.
Oh, that's so, so amazing. And I mean, that kind of, brings us to like, what is that age? Like, when do we start? Do we, like, obviously, a lot of people adopt dogs, so kind of, they might be different ages, but ideally, when is that right age to actually start?
The minute they come home.
Okay.
So, with the program that I put together for core strengthening, I s the what I my rule is 16 weeks old to 16 years old, totally safe. And then there's challenges for anything from a fragile dog all the way up to a competitive athlete. So exercise at any age. And again, in humans, right? What do? We put our kids outside to go play,
Yeah.
right? Swing on the monkey bars, run around, play flag football. And it goes all the way to silver sneakers, right? Where we're doing older people just doing sit to stands, right? On a chair
Yeah,
yoga.
exactly. Oh, wow. And Dr. Laurie, I want to kind of go back to those muscles and everything. People always like kind of talk about, oh, this is a trigger point, or
Yep.
the dog gets a spasm or something. Like, how do these points actually show up in dogs, and like, why do they matter?
Okay. So if actually, you can do this. Take your hand and come up to your shoulder, other shoulder.
This
There
one,
you go.
this one.
And if you feel right here, you're going to be like, oh, I put pressure there and it hurts. Right?
Yeah.
Can you feel that? That's
Yeah.
a trigger point. So now you know
Oh.
exactly what a trigger point feels like. So if you feel what normal feels like on your dog, and then you go, oh, yeah, there's that hard point in there, or they can't stretch all the way,
Mm.
then there's a trigger point or a fascial restriction, and you can get rid of it. Can I play as long as we're doing video?
Yes.
Okay. So take your hand, put it back on that trigger point.
Yeah.
uh, all right. And then I want you to put pressure in so you feel it.
Mm-hmm.
And you're going to take a big inhale. Exhale, and then put more pressure on in your comfort zone. We're
Ooh.
going to do that one more time. Inhale, exhale, and put more pressure on it. And then feel it. It should be gone.
Oh wow. Oh wow.
Right? And
Yeah.
what's crazy is you don't need the dog to breathe. You can do the breathing for the dog.
Yeah. Oh, that's so
So,
interesting. Yeah.
you want to
Wow.
play one more?
Yes, let's do it.
Okay. So you're going to stand up.
Mhm. Standing?
You're standing?
Yes.
Okay. I thought you were sitting.
No,
Okay.
I'm standing.
Okay. So then I want you to turn sideways. Yep. And I want you to bend down and touch your toes or as far as you can go.
Yep, touching
Okay.
toes.
All right. Now take a big inhale, a big exhale, and then reach further. Isn't that cool?
Yeah.
Yeah.
Wow. So definitely with the breathing, the some
So breathing helps. And there's actually studies that show that when you do a long exhale, or think about like sighing, that stimulates the vagus nerve, which is one of our cranial or brain nerves that come all the way down through our body and causes relaxation, turns on the parasympathetic nervous system. So
that's so
breathing is
cool.
huge.
And that's
So
exactly the same probably with dogs as well. But
mhm,
like, how do you get them? Like, I don't, like, I'm not sure Piper would get it if I'm like, breathe
yes.
in, breathe out.
So literally, what I want you to do is when Piper, it seems like she's stressed,
Mm.
I want you to, and that will help her calm down. In a pack situation, if the leader of the pack yawns or sighs, everybody knows to relax. And if
Oh.
the leader of the pack, everybody's epinephrine, right? Or
Yeah.
adrenaline kicks in and they're on alert. So you can use it's literally your breathing is talking to your dog in their own language.
That's so cool. Definitely going to try that.
Mhm.
Yeah, we'll work on the judgment. She's very judgy sometimes, so we'll do the breathing then as well. Calm
Mhm.
down. Yeah.
Yeah. Okay,
And
and take it one step further, if you put your
mm,
hands on them as you you can take that energy through your hands, and that will help her
ah.
relax significantly
Even
faster.
more. Oh, that's
Yeah.
so cool. Wow. And I think especially with dogs that tend to get very stressed, that is
Mhm.
something that that will be very, very helpful. And yeah, so kind of looking at those trigger points. So now we've got the breathing exercise to kind of do. But what if there are some that is very like persistent and we
Mhm.
can't get them on that first time or second time, or maybe when there was surgery or injuries and things like that, why do they persist, or how can we get rid of them as well?
So think about it. We get trigger points or tight muscles, big picture, from either overuse or abnormal use. Like if you haven't gone running for a while and you go running, when you come back, like the next day, your quads are going to be really tight, right? Because or stiff because that's overuse, right? To your body. Now, if you keep doing it, it's going to be easier and easier. Think of your dog who Piper had surgery, the diagonal limb, right? We're going to shift our way to the diagonal limb
Mm,
or the limb on the other side or both are now abnormally used. Their position is different. So they're using different muscles. So they're more likely to get trigger points. And again, your stretching, your massage, all of that stuff can get rid of it some of the time. right? There, I showed you the ischemic compression, but
Mm.
obviously that's not the only thing because it doesn't work all of the time. It's just an easy one to teach. There's other things like the tuning fork, right? That we can stimulate or activate and then put it on the trigger point, and usually within 30 to 45 seconds, trigger point's totally gone.
Oh,
You can
wow.
use, yeah, we have a course on using the tuning fork. Um, we have lasers, right? Lasers are amazing. They are great at getting rid of trigger points, and they do so much more. Lasers can
Okay.
help increase blood flow to the kidneys or the liver. There's studies during COVID that laser helped get rid of the inflammation in the chest so people could breathe and not have to be on ventilators. Lasers help shut down the inflammation from the cells on the inside of the joint capsule so that there's less inflammation and so there's less arthritis building up, and actually decreasing the inflammation so that you can then have more motion in the joints so that you can strengthen the fascia, the tendons and ligaments and everything that supports the joints so they're less likely to re-injure. So there's
Oh.
all kinds of great things you can do.
Yeah, because I feel that is something that is not talked about too much, like, or
Mhm.
at all in some cases, because that is one of the things when we kind of Piper had a luxating patella surgery when she was under 2. She was just under 2, and I literally saw her kneecap snapped out as she was doing a crazy run.
Yep.
And then, we were kind of told now, okay, you have to kind of get her on a joint supplement now because she'll most probably get arthritis. And I was like, yeah, but isn't there anything else we can do? And now you're talking
Mhm.
about this laser, and I'm like, yeah, maybe that's an option. So,
Yeah, yeah, and actually, we have a course because when my house call practice is, um, well-educated people that really care about their dogs, and 70% of my clients had lasers, and 0% of them knew how to use it.
wow.
So, I created a course so that they could learn how to use any joint, any issues that they had with their joints, that, they could understand how to, "Oh, can I play with you? Can I show you?"
Yeah, yeah, please.
So let's look at a knee, right? Because I have knees and stuff around, right? So this is the
Like
kneecap.
you always do.
I do, I do. I love to teach, right? And I'm a visual learner, so I learn better if I have something I can see and touch and feel. So other people do too. So here's the pelvis, right? That would be
Mhm.
the spine up here. Here's the femur coming down. Here's the knee. So if the dog's knee is just like this, and you laser, you're going to get some of the tissue.
Yeah.
But if you bend the knee,
Oh.
right? So now we can get all of the cartilage here by being in flexion. And then when we extend it, we turn it to the back and we can get the rest of the cartilage here, right?
Oh.
So positioning of the dog, from the back, we want to come in this way to get to the cruciate ligament.
Yeah.
From the front, we want to have it bent and we're going to have better access to the cruciate ligament. We want to get the whole joint capsule. The joint capsule actually comes to way up here. So we
Mm.
want to get around the patella or kneecap. And we can actually, by moving the patella when we're lasering, we can get into the cartilage underneath that patella on both
Oh,
sides,
wow.
as well as sliding the patella over and getting the cartilage on the back side of some of the patella.
Yeah.
And that slows down or stops the arthritis.
I love that. That's amazing. And I mean,
Yeah.
that is over the long term, if I just think about what these joint supplements is costing, you will most likely pay off that laser in like no time. It is
Oh, yeah.
obviously an investment, but yeah, for the longevity and making sure your dog is fine. And then how many times do you use that? Is it like only a couple of times a week? Is it like a daily thing?
It totally depends upon what happens, right?
Okay.
Your dog just had back surgery. Yeah, if it was my dog, I would do it twice a day for the first 3
Okay.
days and then start to spread it out. Your dog has arthritis and it's been going on for 6 years. Yeah, start it off, if all you can do, like if you were going to your vet, they would say, come in once a week for 6 weeks and you'll see a difference, right?
Yeah.
If you do it twice a week, it's going to happen faster. If
Okay.
it's at home, you can do it once a day for 3 days and then every other day for 3 to 6 times. So it
Okay.
depends upon if it's acute, meaning brand new, or chronic, it's old. Um, and when you talk about paying off your laser, It's a laser, a good laser, right? A
Mm.
crappy I don't know if I can say that.
That's
There's some
fine.
cheap ones that aren't what they say they are,
Yeah.
and there's really good lasers.
Okay.
And good lasers are affordable, they're a little bit more pricey, but they will last for decades.
Wow.
And I have clients who have literally, used them through 5 dogs, right?
Wow.
Um, and I'm not a human doctor, I don't tell people what to do, and all of my clients that have lasers end up using it on themselves, right? So when you think about the value of it
Mm.
and knowing how to use it, how important that is, it makes it, I think we figured out it would take, like, about 60 uses to pay off the laser. But
Okay.
if you've got multiple dogs or dogs and cats and you're you're able to do it at home,
Mm.
you actually pay it off really quickly, and then you're saving a ton of money.
Yeah, definitely. And I feel obviously if you have the laser, you're going to be more prone to use it versus
Oh,
if
yeah.
you need to pay, a couple of $100 every single time to do like the 6 sessions. And then,
Yep.
it's only for the 6 sessions. And also like here where we are, like the physio that actually does the laser, she's so busy that
Mhm.
you almost can't get in, so it makes it then a lot easier for you to be able to do that. But yeah, I think it's good to kind of have a look at the course and see whether you'd be confident enough to do it, because
Mhm.
I think some people might be, oh, this is medical equipment, I'm not sure. But it seemed like it looked pretty easy, and you've done shared a video as well where you were doing laser on Sid, I think. And yeah, so but you're a trained professional. That's the other thing as well. But it
But
really kind of you explained it quite well to, like, this is how you do it.
yeah, I am a trained professional and I love teaching. And I'm able to one of my God-given gifts is being able to take complicated things and simplify it so people feel comfortable working with their dogs and having great results.
Yeah. That's amazing. And I think in the end, that's kind of, we just want those healthy dogs to live as long as they can and have
Mhm.
a healthy, happy life. So I think that is so, so key. And I mean, we kind of touched on this is not a senior problem. Like, we need
Right.
to drill this in people's heads when your dog is starting to show signs of aging. It is it might not be even that, it might be
It's
one of these
way
things we've
before
gone through.
that.
Yeah.
We 20% of dogs a year of age or older have arthritis, and by the time they're
Wow.
7, it's like 80% of dogs have arthritis.
Oh my gosh.
So why wait until they're painful to do anything,
Mm.
right? My rule of thumb is for my athletes, get them on supplements between 6 and 12 months because we
Wow.
know they're
Okay.
gonna be hurting their joints and their
Yeah.
tendons and ligaments and putting pressure on them. And
Wow.
for my other dogs, by the time they're 2, 3 tops, get them on something to help prevent so that they can run and play when they're 10, 12, 14 years of age.
Yeah. Wow, that's interesting. And is there other things other than, the joint supplements or things that we can do to help um, their kind of joints when they're still little or as they kind of age as well?
Well, exercise is huge, right?
Okay.
Because your exercise and your stretching is going to help strengthen the tendons, ligaments, and fascia around all the joints to decrease, right? Core
Mm.
strength, keeping them thin. Obesity, I don't know about in Dubai, but here, two-thirds of dogs are either overweight or obese.
Mm.
And the fat itself produces hormones. Fat is an endocrine organ, right? It produces hormones that cause inflammation, which
Wow.
breaks down your joints and other organs and causes problems. So keeping your dog lean is super important. Knowing your dog, getting your hands on your dog, being able to know, okay, so can I give you some generalities?
Yes.
Okay. Every dog, every breed, if their back and neck are straight, should be able to bring their front leg all the way up to their eye. Every dog, every breed.
Really? Oh,
Yeah.
wow.
So
That's
back
so
is
cool.
straight, head's at 90 degrees. Everyone should be able to do that. If not, there's something, some muscle or substructure in the
Mm.
shoulder that is not allowing it. Every dog, every breed. If you take their front leg back, should be able to either point to, if it's a dachshund or corgi, or touch their knee if their back leg is in normal standing position. Again, keeping their spine straight.
Oh, wow. That's so interesting.
Every dog, every breed, if their back is straight, they should be able to take their back leg forward up to their knee. Now you have to
Oh.
keep the back straight because you can
Mm.
cheat and do this, but then you're putting stress on their lower back and not
Oh,
stretching their hamstring. And
okay.
then when you, oh, see, bones come in helpful again. If we have the hip here, every dog, every breed, we should be able to bring that back leg back, but you have to hold on to the pelvis. If you don't,
Okay.
if you just take the back leg and go back,
It
not only are
goes.
you extending the hip, but then you're extending the SI or sacroiliac joint and the lumbosacral joint and the lower back. So,
Oh,
um,
wow.
again, knowing what normal is, so
Mm.
playing with your dog when they're young or now, right?
Yeah.
Wherever they are now, and knowing where their normal is will allow you to be able to know when they're abnormal
Oh,
and
that's
find the
great.
problems before they're lame, before
Yeah.
they hurt.
Yeah, because I feel that is there's so many different things that we need to look at, and I mean when it comes to especially like going back to that weight, like
Mhm,
I make sure Piper goes to our vet at least maybe every second or third week just for get onto the scale. I could probably weigh her at home as well, but I feel she's not a fan of the vet. So going there just to
mhm.
get weighed makes it a
Oh,
little bit
yeah.
more exciting. And that way I can see if she's picking up weight. Because when we
Mhm.
started with the joint supplement, she refused to eat it. So we had to cover it in a little bit of cheese. And then, yeah, that add a little bit of extra weight.
Uh-huh.
Which we then had to lose. And like now we're able to like make these little pill pockets from her
Mhm.
raw food that I have to put in the air fryer, otherwise she doesn't eat it. So now she can actually eat it with her food. But it was really, and I mean, it was, say, in a maybe a month, she picked up 300 grams. And I mean, I don't know what that is
Wow.
in like pounds, but it was a lot.
That's a lot,
And
yeah.
yeah, so then I was like, no, no, no. We need to do, she needs to immediately, we need to sort this out. So then obviously she went on a little bit of a diet
Sure.
and she's got a crooked spine as well. So that's
Mhm.
one of the things that we knew she had. And that's one of the things why they said she needs to be like her weight needs to be on the dot. Otherwise, you're going to have so many issues.
Yep.
And yeah, so it's definitely something for our listeners. Go and see what type of score are your dog getting on that scale and make sure it's a healthy one.
Yes, absolutely, absolutely. So, give you an idea in the Purina study, they found that the dogs that were pet weight lived their life, and the dogs that they fed 25% less, so they were lean,
Mm.
actually lived 15% longer. So that is
Oh,
2 years longer if you were a lab-sized dog, and bringing it down to the little guys, that would be like 3 years for, like, a Chihuahua-sized dog. They
wow.
had 50%, so these are split litters, right? So same genetics, 50% less hip dysplasia in the dogs that were kept lean. It's
Wow.
super important, especially
Yeah.
as they're growing.
Oh, that is so I'm so glad you mentioned it because it is something I'm always like when you see these dogs and I'm like, mm,
Mhm.
yeah, maybe not that extra treat, but yeah, so it is definitely important. And I mean, talking about food, something that most of the dogs love, how important is the way that the dogs eat?
So I highly recommend elevated bowls for some dogs, and I highly don't recommend them for some dogs. So it's definitely depending upon the dog. If you have a deep-chested dog like a Great Dane, there's a slight chance that if they have an elevated bowl, they're more likely to have GDV or gastric dilatation volvulus, where their stomach twists.
Mm.
So for those guys, unless they have neck issues, then we like to have them eat on the floor. Dogs that have any kind of neck issues, it's much better for them to have have an elevated bowl, and we want to have it so that they can literally walk up to the bowl, put their head down, and the food is right there. so that it's not putting stress on their neck.
Mm.
We even see some of the dogs that have had back, like middle of their back issues, when they have to put their head down, their back does one of these and
Oh,
it puts
wow.
stress because we have spinal issues at areas where it changes. So we call them transition points. So upper cervical, lower cervical, thoracolumbar, and lumbosacral. So if they have, and unfortunately, thoracolumbar, so right in the middle of their back, is very commonplace for them to have back issues. And if their back hurts, sometimes leaning down to get to that bowl, they have to choose. Do I lean
Wow.
down so I can eat and deal with the pain, or do I not eat?
Mm.
Right. So you may say, oh, my dog's being finicky. And it may be that I'm hungry,
They're in pain.
but it hurts. Right.
Yeah.
And just by
Wow.
elevating that bowl, they'll be like, oh, yay, I can eat without pain. That's great.
Oh, that's fantastic because yeah, for some dogs and like we've noticed with Piper as well, it might have been with her teeth and obviously also having a stiff like neck
Hmm.
because she like after we've done everything, she's actually loving food and she used to be
Yeah.
like this like picky,
Hmm.
person like not have wanting to eat the food and I used to like hand feed her and sometimes that
Hmm.
was the only time when she would eat. And like now, like what you're saying and knowing what's happened, I'm like, it's making sense. Like why did it take us so long to get here?
Well, and how awesome that you're sharing Piper's story so other people can hear it and learn it and recognize it if that's what's happening with their dog as well.
Exactly. It's just those subtle, subtle things. And then ask for help or,
Mhm.
I mean, your website, and we'll link it in the show notes, is full of amazing stuff where people can really support their animals. But if someone actually wants to support their dog's mobility at home, like where is that safe place to actually start?
Exercise. Exercise is so, so, so important. Again, we have Core and More, which is for pet parents. It's 24 different exercises, everything from literally just having them stand square and picking up a foot. And you're like, why would that be an exercise? And I would say, if you're curious about that, stand on one foot and hold it for 2 minutes. Right?
Wow.
And most people, unless they're a gymnast, will be like, "Oh, wow, I'm really using my core. Oh, wow, I have
Yeah.
to put my foot down," right? And it's the same kind of thing with the dogs. That and touch your dog. Touch your dog. Know where their trigger points are. Know what their muscles feel like. Know what they can do so that you know when they have a problem.
Yeah.
Super, super important.
I love that. And I mean, that is so key. And again, just like putting that point out that don't wait until it is actually a problem. Like, catch it when it's
Right.
like little things. And because even for you, like, yeah, if your shoulder is a little bit sore, maybe a massage will go and do the trick. But if you leave it for like another month and then go and run a marathon or something, you might need surgery. I don't know.
Think about it, if your shoulder's bothering you and you're doing this because your shoulder's bothering you, then you have issues with your neck. And then you're doing this and you're not moving your neck, so then your spine has issues, right? That's
Wow.
in rehab, one of the terms we use when we have a dog that's had an issue and then that something is complicated and it's compiled and it's compensated and they come in and we call it a train wreck. Right? Because there's 10 things going on. And it's not like, "Oh, we can do one thing to fix it." We have to peel back the onion, and we're gonna make
Yeah.
this better, and then this may look like it's more sore, but it was just that this was even more sore than that. And then we slowly peel back slowly or as quickly as we can, peel back the onion until the dog feels really good.
If you wish there was only like one thing that dog parents could actually pay more attention to when it comes to the movement and the comfort of their dogs, what would that be?
I call it function of daily living. So, going from walking up, say, just first start, the stairs. Right? Do they "Wah!" and run up the stairs and run down the stairs? Or do they like, "Okay, I think I'm gonna go," right? Do they hesitate to go up and down the
Yeah.
stairs? And if they go up the stairs, do they with their back feet? Because when you go up the stairs, you are putting more weight on your back end, right? Gravity is pulling you down. So do they go step, 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 or do they go step, step, right? Because then they're pushing off with the leg that doesn't hurt and just bringing up the leg that
Oh.
does. And same thing when they go down the stairs, now the weight is shifted to the front, gravity's down the front. Do
Mm,
they hesitate to go down the stairs because then it's is there a neck issue because I don't wanna have to do this, right?
mm,
Or is it something in the front legs, and do they go right, 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 or do they go boom, 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 boom? Do they jump on the couch the same way? Or do they hesitate or like climb onto the couch now?
yeah.
Same thing with the bed. Or, and you come home from wherever you are they right there at the door to meet you like they were when they were puppies? Mom, 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 I'm so excited to see you. Or are they
Yeah.
laying down going, oh, yeah, hi, mom, right? That's a big one.
Yeah, because that's one thing with Piper. She's never as excited, but that was like her since puppy. Like she'll be like, I'm excited, but she's like on the sofa doing the excitement and then like
Yeah.
thinking, okay, are you coming? Are you coming? And then she'll come if you're not coming immediately. But yeah, so that is definitely something to look out for. And what changes do you kind of notice in these dogs when their bodies actually start feeling better after, they weren't so great?
They're more playful, they're more interactive, they're looking for attention. If you ask them if they wanna go for a walk, their ears perk up, right? Their eyes are brighter. One of the things my clients always say when I work on a dog is that, "Oh, wow, their eyes are brighter." It's more like there's somebody home, right? Pain or a discomfort, they're just not as happy. And then
Mm.
they get excited, right? Because they feel good. They may eat better, they may move more. We just want them to act like a puppy again. And you can say, well, they're older.
Mm.
But I know dogs who are 14 and still acting like a puppy.
That's great, and it gives me hope, obviously, as Piper is, getting older each year, but we're going to keep her in that puppy phase and doing some of your exercises.
Okay.
Dr. Laurie, before we go into where our people can find you, is there anything you felt we've missed out on? Anything you want us to still dig in?
Mm, I think you got it. I mean, fascia, exercises, laser, getting your hands on your dog, exercise your dog is so, so, so important. I think in this day and age, so many people are sitting in front of their computer or on their phones scrolling that they forget that their dog's laying at their feet,
Mm.
right? And get them out, get them moving, get them in the yard playing, or even doing the controlled exercises to strengthen the muscles. So, so, so important.
And for our listeners that might be hearing and not watching this video, you are actually giving them access to an ebook
Yes.
with like 5 exercises, which is fantastic. Can you tell us a little bit about that and then where people would be able to find you?
Absolutely. So it's the top 5 exercises for geriatric dogs, and they're really the top 5 exercises you can do with any dog. So even your
Awesome.
puppies you can do them with. It's like 26 pages, so it's not like a one-page PDF with a I am anal retentive in how I teach, so it's got a lot of information on, what to look for, how to do it, what the dog should do, how they cheat, right? Because dogs are smart, most of them.
They are.
Right, and we won right, and if we went to the gym and the trainer says, "I want you to do 20 push-ups," and then they left the room, you might only do 15, right? So, it gives you a lot of information on the exercises that will strengthen all parts of the dog's body, so it's a great way to start. Let's see, it's got color pictures, it has information in there on a lot of great things. And then to find us, we're at optimumpetvitality.com, and we have courses and information on all kinds of great stuff because I love to teach.
And they can also buy the forks
Yeah,
on there
yep,
as well,
yep,
right?
and we have the tuning forks.
Yeah.
Now I don't know
What
that we
what
can
what is the
to buy
difference? Because I see there's all the different like
stones.
stones.
Yeah.
Yes.
So, actually really cool. I just found some research that shows so this is 128 hertz.
Oh
There
wow.
was just research put out that 130 hertz, so very close. And when I put this, I'm anal retentive. So when I put this on my tuner, it's 128, 129, 128, 129. 130 hertz is what stimulates the vagus nerve. So we can use it for relaxation and calming just by activating it, right? Because that's the sound. The
Mm,
fact that it has the weights on it pushes the energy down to the bottom. So we can literally, like, you can see how this slides on me,
mm,
right? So that there's no fascial restrictions. This is a therapeutic tool as well as a diagnostic tool. So if I put it on a trigger point in like 20 seconds, the trigger point is gone from the vibration and clearing the fascia. If
mm.
I put it on, let me see. Oh, my neck's not bad. There you go. Can you see the grab there?
Oh,
See how it doesn't
wow.
slide, it
Yeah,
grabs?
yeah.
That says there's fascial restrictions. And if I
Oh.
were to activate it and put it there and hold it for a little while, and I might have to
Mhm,
activate it a couple times, that vibration will break up the fascia and allow that fluid to go through to help the whole immune system, the toxins, and stuff like that. And then we can clear that. We can clear the
mm,
lymphatic ducts and the lymph nodes and all of that stuff. We use the amethyst
mhm.
for trigger points, so for soft tissue and fascia.
Okay.
And there's other stones that are amazing for other things. So, like, when Sid, my amazing athlete ninja dog, had emergency abdominal surgery, and I was traveling in and out, and I came home from lecturing, and the incision was infected. And he had significant scar tissue. And my dog, who can do sit up and beg 80 times in a row, couldn't do sit up and beg because the scar tissue was pulling him forward.
Ooh.
And I tried the amethyst, and it's like, it helped a little bit. I tried the laser, it helped a little bit. And I'm like, what do I do? What do I do? What do I do? I'm like, oh, wait, lapis. Lapis is good for scar tissue. Within eight
Okay.
minutes, it was totally flat.
Wow.
It was crazy. I've had people, because I teach with, I think it's called like deuterymitrins, where their fingers curl in and they
Yeah?
get scar tissue. My brother-in-law had 6 months of PT and he couldn't straighten his bottom 2 fingers, and they were talking about either injecting collagenase, so an enzyme to break up collagen, which is the scar
Wow.
tissue, but also the tendon, or doing surgery and scraping, and what happens when you do surgery? You get more scar tissue.
Yeah.
And I was there last year for Christmas, and he used the lapis, and in 4 days of me being there, his hand's totally straight.
Oh,
And I just saw
wow.
him this Christmas, and his pinky's starting to come in just a little bit, and I'm like, "Bill, you have a tuning fork." He's like, "Yeah, but it's still pretty functional. When it gets bad, I'll do it again."
Oh
"Okay."
my gosh, just do it before it gets bad. Oh, that's
Right.
amazing. So there's definitely, and also from your courses and things, we can see which one is
Yeah.
best to use. So
Yeah, yeah.
yeah,
I had
awesome.
I had I was at a conference, and I had a chiropractor who, when I'm at a conference, I say, "How can I help you? What can I teach you?" And she said, "I've had ulcerative colitis for 12 weeks." Right? Ulcer, meaning
Mm,
blood, right, abrasions in her colon. And I'm like,
wow.
"Well, this isn't gonna help you." And I'm like, "Okay, what can help the GI?" "Oh, yeah, citrine. Citrine's for GI." And so we got rid of the sticky icky. So what you saw here, right, where it
Mm,
grabs over her, like below her solar plexus, over her abdomen, it took like 20 minutes. And the next day at the conference, she came and she said, "Lori, Lori, Lori, oh my God, I can't." She said, "I did the skinny dance." And I'm like, "Okay." She said, "I had pizza for dinner last night. And for the first time in 12 weeks, when I got done, I didn't look like I was 9 months pregnant.
oh,
All the
wow.
inflammation in my GI tract was gone." Now,
Wow.
can I tell you that's gonna last forever? No. That was the first time I had seen that, but I'm
Mm.
like, "This stuff is so friggin' cool."
Yeah, definitely worth exploring
Yes.
further. So, yeah. Well, thank you so much for being such an amazing guest on the show and for all the wonderful work that you do. Like,
Thank
obviously,
you.
not just like helping the dogs, but helping us pet parents actually also help our dogs as well. So, thank you.
Oh, you're welcome. Yeah, my life mission is empowering people to optimize pets' health.
Oh, well, I think you are doing that spot on because even I feel, like we might get that laser and tuning fork, and Piper is going to
Mhm.
have a very interesting, like sessions in front of the TV while we're doing laser. I
Thank
think
you for
that's
having me.
Dr. Laurie, thank you again for sharing your time and your expertise with us. This was such a thoughtful conversation. So, when it comes to our dog's movement and comfort, maybe it's not about waiting for something to be wrong, but about paying attention to those quiet patterns that shape how we feel every single day. Thank you so much for tuning in today's episode of Tales and Tones. If today's conversation spoke to you, I would love for you to leave a review on podchaser.com or share the episode with a fellow pet parent who might need to hear it too. If you've got any questions, thoughts, or just want to come and say hi, I'm always around on Tales and Tones Instagram, where every tale tells a story and every tone speaks from the heart. See you in the next one.